A doctor terrorized nurses and called us glorified assistants, and that we were just there to follow orders until the medical board examiner asked to see his license. Dr. Maxwell had been terrorizing the nursing staff at Riverside Medical Center for 8 months. Every morning he'd storm through the cardiac unit, announcing that nurses were just glorified assistants who couldn't cut it in medical school. He'd stand at the nurses' station eating his breakfast while we worked, commenting on every single thing we did. If you were smart enough to be doctors, you wouldn't be fetching bedpans, he'd say loud enough for patients to hear. His favorite target was me, Rebecca, the charge nurse with 15 years of experience. He'd interrupt my patient consultations to correct things that weren't even wrong. He'd tell families that nurses were just there to follow his orders, nothing more. The other doctors stayed quiet. They needed his referrals. He brought in wealthy patients from his private practice. Dr. Maxwell had connections everywhere. His father owned 3 medical facilities in the state. His golf buddy was the hospital CEO. He made sure everyone knew it. Nurses are replaceable, he told the director of nursing last month, but doctors like me, we're the reason this hospital has prestige. You should be grateful I even acknowledge your staff. The breaking point came during a code blue. A patient was crashing, and I was running the response before Dr. Maxwell arrived. When he walked in, he shoved me aside. Move, nurse. Real medical professionals are here now. He grabbed the chart from my hands and started barking orders that made no sense. The patient was in diabetic ketoacidosis, but he was being treated for cardiac arrest. I tried to correct him. Dr. Maxwell, the glucose levels indicate. He turned on me in front of the entire response team. Did I ask for your opinion? You're a nurse. You follow orders. You don't think. That's why you're not a doctor. The patient almost died. Another doctor had to step in and fix Dr. Maxwell's mistakes, but Maxwell blamed me in the incident report, saying I confused him with incorrect information. That afternoon, the state medical board showed up for a surprise inspection. Dr. Maxwell wasn't concerned. He actually seemed excited to show off for official visitors. These inspections are really just formalities, he told them. Excellence like mine speaks for itself. The lead examiner, Dr. Harrison, was reviewing credentials with the administration. She called Dr. Maxwell to the conference room. I happened to be filing paperwork nearby when he strutted in. Dr. Harrison looked up from her files. Dr. Maxwell, we're reviewing all physician licenses as part of our audit. Can you provide your renewal documentation? He laughed. Of course, it's all on file. Been renewing for 20 years without issue. Dr. Harrison frowned at her computer. That's interesting. According to our records, your license expired 7 months ago. The room went quiet. Dr. Maxwell's smile faltered. That's impossible. I've been practicing here for 8 months. Check again. She turned her screen toward him. You failed your continuing education requirements. 3 notices were sent. You never completed the mandatory training hours. But more concerning is this. She pulled up another screen. You've been practicing medicine without a valid license for over half a year. That's a felony in this state. Dr. Maxwell grabbed the desk. There must be a mistake. I'm Dr. Maxwell. My father owns. Your father's influence doesn't extend to state licensing boards. Dr. Harrison cut him off. You've been illegally practicing medicine. Every patient you've seen, every prescription you've written, every order you've given in the last 7 months has been unauthorized. The CEO, Dr. Maxwell's golf buddy, went pale. Have we had an unlicensed physician on staff? Dr. Harrison nodded. Every procedure he's performed is legally questionable. Every patient could sue. The hospital's insurance won't cover malpractice by an unlicensed individual. You're looking at catastrophic liability. The CEO turned to Dr. Maxwell. You told me your credentials were impeccable. Dr. Harrison wasn't finished. There's more. We investigated after receiving complaints about your treatment of nursing staff. Turns out Rebecca here, she has her doctorate in nursing. She's more qualified than you even when your license was valid. She teaches at the medical school you claim to be so proud of. I tried not to smile. Dr. Maxwell looked at me, then at Dr. Harrison. But she's just a nurse. Dr. Harrison stood up. She's a licensed medical professional. You're not. As of this moment, you're banned from practicing in any medical facility in the state. Security will escort you out. Dr. Maxwell tried to argue, but security was already there. As they walked him past the nurse's station, he was muttering about his father, his connections, how this couldn't be happening. The nurses all watched in silence. The CEO sent out an email that afternoon. All of Dr. Maxwell's patients would need to be reevaluated by licensed physicians. The liability was astronomical. Dr. Maxwell's father disowned him publicly to protect his own medical facilities from association. Last I heard, Dr. Maxwell was working as a medical equipment sales representative. He has to get permission from actual nurses before entering any hospital.